That's what you're supposed to do in the
What's
interview.
up,
What you
man?
do?
It's your boy MoonDog38732 for the MoonDog38732 show on YouTube. Hey, man, watch the show, like the show, subscribe, share, and comment at the same time. Don't forget about the .com and the podcast with my homegirl, Tiffany DJ. The Tiffany DJ collection is still on my website, on our website at the MoonDog38732show.com. My merchandise is still on there. Also, the hood hoodies, the A-Lo, church, all that stuff is on there. You know what I'm saying? I got that. Eastgate, we got that. With that being said, man, I have a very, 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 very special guest with me today. She's been one of my closest, dearest friends for 20 some odd years. You know what I'm saying?
Yes.
We've been through a lot. She's seen me at my lowest points. She's seen me at my highest points.
Yep.
Let me get a little taste, of water with that right there. So, with that being said, dearest friend, could you please introduce yourself to my audience?
Hi, audience. My name is Monica Woods. I'm originally from Mississippi. I am on tonight discussing very hot topics tonight. We are talking about lupus. Drake and I have been friends, like you said, for a long, long time, and he asked me to be on tonight.
With that being said, I always do the black business things and stuff like that. But with this COVID pandemic and stuff popping off, a lot of time we forget about some of the other things that are out there and have been prevalent for a while, particularly lupus. I have a few people that I know that have lupus has been set upon them. So, Miss Woods, could you tell us about lupus? Because a lot of people may not actually know what it is. They may have heard about it, but they don't really know what it is.
Alrighty. According to a book entitled The Lupus Book by Daniel J. Wallace, the term is lupus erythematosus, but we call it just lupus. It's developed when the body becomes allergic to itself. Immunologically speaking, it is the opposite of what takes the place of cancer or AIDS. In lupus, the body overacts to an unknown stimulus and makes too many antibodies or proteins directed against body tissues.
Wow. So, in other words, the body is really turning on itself. Sound like it's kind of eating itself up
Yes,
with these antibodies and things like that.
yes.
So, what are like the treatment options for the people that have lupus?
Well, it also depends on which one you have, but there are several treatment options which are like Advil, Motrin. Those are the things that we get over the counter for like swelling. But there are also actual drugs that we can get that are prescribed by the doctors that are more like 800 milligrams. But every drug that pretty much we all know, there's a side effect. So we deal with that as well. So, too many of those, what they call NSAIDs, pretty much it could cause stomach bleeding, kidney problems, increased risk of heart problems. They also give us anti-malarial drugs, which is called Plaquenil, which is one that I'm on. But that one also cause your stomach to be upset. I have like a GI problem where if I get too upset, my nerves and my stomach starts to bother me, and it causes you to have issues with your retina in your eyes. They also have cortisone steroids, so it's pretty much prednisone is the one that they give us, but that causes us to gain weight. It causes bruising to our bones. It causes us to have high blood pressure, diabetes, and it could also increase. I mean, the risk of you having several infections that you wouldn't be susceptible to, but because you're on the steroids, it kind of makes you be able to be more susceptible to them. They also have other drugs that are like immunosuppressant drugs that pretty much help to kind of ease the pain, but most of the drugs that they give us, they really don't work. It's just kind of like a stimulant to kind of keep us out of pain for the moment. Is to keep us here, but it's more side effects to them than there are pretty much anything else. But it keeps us out of pain for the moment.
Yeah, because I was about to say, so a lot of things that you was naming at first really just for pain and stuff like that. And
Yeah,
I don't know if it's actually helping or being used to treat lupus itself, but it's only it just used to treat pain.
it's
I'm
just the
like,
pain. It's nothing
right,
they can really do about it. It's more so just to keep us comfortable.
okay. So I'm gonna ask you this: how has lupus? Hold on. First of all, how long have you been dealing with lupus?
So, that's an interesting story, and I'm glad you asked. So, I was misdiagnosed for 20 years. I was diagnosed in February of 2006 on the 2nd. I was extremely sick for about 2 months. My legs were swelling. I went to work, couldn't wear any shoes, so I went to the like the Family Dollar and bought the little ballerina shoes because that's the only thing I could wear, and I had to have a sole on my feet. And I had to get approval from my nurse, and she was the one that said that, hey, you have to leave. You need to go see what's going on because it went on for months and months. So I was misdiagnosed. I went to the ER, and the guy um, did a lot of tests. They put Dopplers on my legs because my legs were so swollen that they couldn't figure out what was going on. They did all kind of, like, I had like 20 vials of blood taken from me, and he did one more the next morning because they had to keep me overnight, and that's how they found out I had it. And then my test results was given to another doctor, and she said I could have had it as early as 15 years old, and they didn't diagnose me until 2016.
Wow. Whew. I was about to ask you how has it affected your life, but I think you pretty much summed it up.
Well,
But
I will add to that. The way it has affected is I'm now having blackouts. I have to be very careful about what I eat. Um, I have been on a walker at the age of 30 and 38, extremely like on a walker, like can't go to work, have to call off. Um, I have to be mindful of glasses now because, like I said, the Plaquenil really the medicine that I told you about earlier is now affecting my eyes because, as you know, I've always had glasses, but now I'm noticing like I get dry eye, I get like a blurry sensation. I have uh sunlight. It really bothers my eyes. My skin burns, so I have to wear long sleeves during the summertime. And each year is something different. So yeah, it's affecting a whole bunch. And each year is always something different. The older I get, the more symptoms seem to come around. So this year, the blackouts have started. So now that I have to go in sometime this year and let them do a neurological scan.
wow, that's a lot, buddy. Wow. So what adjustments have you had to make?
I pretty much push through the day, even when I'm in pain. Sometimes I have to grasp my steps or grasp getting up. I feel like my mental state, I have to kind of put it in the back of my head because sometimes I feel like I'm a 70-year-old woman in a 40-year-old body, and mentally it kind of makes me a little depressed. I'm dealing with a lot of anxiety and depression that I wasn't dealing with at first, but that's because of the pain and everything else that comes along with it on a daily struggle, to where, you know, a lot of people don't understand the mental part of it is you're whatever age you are. Like one of my friends, she's only 26 and she can't walk. She's literally on a walker every day of her life. She's going in as of this month to get a heart a stent. she's 26. So this is not something that, we take lightly on any day of the week. I don't take anything away from the cancer patients. I don't take anything away from anybody that has any other serious conditions, but we matter too. That's another reason why, I try to stay positive. I try to cope with everything that I go through every day. I try to keep myself positive, and even with my lupus friends on my page, I try to give something to them as well, because nobody understands what we go through mentally on a daily basis. Like, I've saved several ones of my friends because they wanted to kill themselves, and I read between the lines and I inbox them, and it keeps them from going the extra mile, because I do things like that, which makes me feel better about me, because I've saved someone from doing things to themselves.
Man, sound like you are a true warrior and a friend to others as well, even though you are going through a lot yourself.
Yes.
So, what are some of the things that you have to avoid? I know you say you have to watch what you eat sometime. I'm like, so what does what you eat have to do with your with lupus?
So we all know about COVID.
Right.
So by our immune system already being susceptible to any and everything that others don't even understand, that may, like, a cold for us is like the flu. So by COVID coming into existence, we already can't go out. We can't do like anything where it's more than 10 people in a room, even with the social distancing. Even when I was working, I had to cover my face with 3 masks just to go to work, because I was an essential worker. And I don't get to eat certain things anymore because they have done a lot of studies. I used to love ramen noodles, especially the chicken ones. So they did a study, and I had to take that out of my diet because they were causing me flare ups. So I was like, no, I don't think that that's what it is. So I did a study myself. So I would eat them, and I would notice that, hey, yeah, I do flare up when I go and put the ramen noodles in my system, versus I did like 2 weeks that I went without it, and I didn't have a flare up. So I did know that, I had to learn, how to eat different things. I had to change my diet. I had to start working out more. I had to, pretty much, for me, steroids don't work. So what I had to learn how to do is mentally get myself in a mind frame of, it's certain things that I can't do. It's certain activities that I can't be a part of. And if I do go somewhere, when the crowd gets too heavy, I have to leave. I can't be there all night, or how I used to be when we were in college, where you stay out all night. No, I can't do that anymore because my condition doesn't allow me to do that. So it just changes every area of your life. So that's just about, my lifestyle, and I've adjusted to it. I make up for, just binge watching TV shows.
Got you. We got it. Hey, hey, everybody. I'm about to say, hey, class. I kind of flashback. We got to get her to binge watch the MoonDog38732 show on YouTube. But that's neither here nor there. All right, now. So when you're saying a flare up, could you tell the audience what is a flare up? What do you mean by that?
So, what is meant by a flare up is when your lupus symptoms have worsened, and as a result, you pretty much have an increase in your, I don't call it a disease, I call it a condition, but the quote unquote disease activity is one or more of your organ symptoms, and your lab measurements have increased. So, it's either for me, I have what is called the SLE, which it affects my organs, it affects my joints, it affects pretty much everything. It's starting to affect my teeth as well now, since I survived COVID back in August. So now it's affecting my teeth. So I have to pretty much, I can't move, I can't get up and do much of anything. I have to get either my cane, or I have to have assistance just to get out of the bed, because my legs and stuff are so swollen. My feet are swollen. When it rains, the bottom of my feet ache so bad that I can't do anything. But it's pretty much like what we say how arthritis, you have a swelling is like 10 times worse than a person that has arthritis that has a swelling. It's pretty much a flare up where the increments in your count have exceeded what the normal basis is to keep you on, like, even on your medicine.
Wow. All right. Ooh, y'all heard that. Now, sometimes audience and people that's out there in the on the internet type situation, we don't really know what people going through. We don't know why they're frowning. We don't know why they're smiling. Sometimes we may not even care. But let's roll it over to the next thing. Since we're talking about smiles, frowns, aches, and pains, how does this situation with lupus affect your personality? Because I remember you being always smiling and always laughing. Moondog, I can't say my real name, but that people that y'all know my real name. But Moondog, let's go do this, let's go do that, let's ball out somewhere, let's shoot over to Applebee's, get something to eat. You know what I'm saying? So how has lupus
Yeah.
affected your personality?
When I'm out and about, well, my worries and I call it is the outside fronting. So we put on the front that we are just the bubbliest person, but when I go home and I'm by myself, or I'm around the kids, or I'm just in my presence alone by myself, I'm really depressed sometimes because, again, you know, at any age since 2016 when I found out, it's depressing to not be able to do the smallest things like take yourself to the bathroom, or, you know, feed yourself. Like, I used to get mad at myself for not being able to do the simplest things. Like, I have tremors in my hands and I used to cook for the children. And one day I got so upset with myself, and I dropped the spaghetti cooking it for the children, and my daughter came in and I was crying because my tremors would got so bad that I couldn't hold it. And, you know, she was, I think Ayana was, I want to say all of 4 years old. And she came and she said, "It's okay, mommy, we'll just wash it off." So she helped me wash it off. And that's kind of, brought me back into an emotional situation where, I began to look at it differently. So I had to change my way of thinking. And that's something else that you taught me, because you used to always say that to me, like when I used to get upset about little things, and I used to hear you, say that as well, like change the way you think about certain things, like don't make everything, an upsetting situation, because you always taught me how to be positive instead of negative, regardless of what I had going on. So I took everything that you said and I started looking at everything in a positive versus a negative, and that kind of helped me get out of my depression a little bit more, because if you stay stuck in a dark place, then everything about you is going to stay dark, and I didn't want to do that, because that also, stress is not good for a lupus person either. It makes you even more sicker, because stress, it weighs on your mind, which, your mind is the heartbeat of your soul and your body. So
Right.
if your mind is so stressed out, then you're going to be aching and paining as well.
So y'all heard what she said. So not only does the physical situation be taken care of, but also it affects your mental, especially you got kids. A lot of times we don't want our kids to see us in a so-called weakened state, because we always have to be strong for our kids, right? So when a situation like your child is like, "Hey, don't worry about that. I'm gonna help you with it." I can only imagine what something like that, how that's weighing on you, as maybe in the near future my child may have to take care of me instead of living
Right.
their own life, which
Right.
which is a heavy burden that'll be on your mind, right?
Right. Correct. That's exactly how I felt.
So I know we heard that you reach out to people and you have a page. Could you tell the audience where can they like reach out to you or follow you or anything like that on any social media platform or website or whatever?
So I'm working on two different projects. But you can find me on Facebook. I can share in the comments on YouTube, but you can also find me at Monica Lupus Butterfly, Mona Shay on Facebook. You can't miss me. Um, I'll share, like I said, in the comments on the actual post once we get it on. And I'm actually working on two different projects that I will share with Moondog at a later date, so he can share it with you guys and let you know. But it's called the Blush Project, which is an educational and an advocacy project that I'm doing to do exactly what we're doing right now, but on a basis to where you can ask questions, because a lot of people, don't understand that the power of the tongue does positive and negative. A lot of people be like, oh, well, you're not sick, or, say things to the nature that they don't understand that it does hurt people, that, when you don't understand something, you need to pretty much be understanding that you don't know what it does to affect a person who may go home and commit suicide because of something that you may have said to them. And then I also have this project that I'm working on that's going to be an extension of my actual Facebook page called Blush. So it's actually called the Butterfly Lupus United Support Headquarters, which is for lupus people that need support. Like I said, I have a lot of friends that don't have people that they can lean on. A lot of them are alone. A lot of them don't have spouses. A lot of them don't have friends. So I just wanted to open up like a place where everybody can come and just, share and have like what we call accountability partners. And once get that accountability partner that comes and checks on you, that makes a person feel better. Everybody is not as strong as me. Everybody's not as strong as the next person. So once you have an accountability partner, you can, be able to do a little bit more better. If you change one person at a time, then another person change another person, and another person change another person. That's 10 people that's been changed. So that's just where it is right now.
Now, y'all heard what she said, how sometimes people just say what they gonna say and don't care how it affects the person what they're saying to. You know, there are people out there, well, I'm gonna say what's on my mind, and how they take it is how they take it. And there's a thing called tact. There's a thing called empathy.
Yes.
Small words like that actually will help you sit back and think about what you're going to say, because you don't know how they're going to affect someone's life, especially when they're going through something as serious as lupus and all these other things that may have been forgotten about or put on the back burner because of COVID and things like that.
Yes.
So,
Yep.
with that being said, is there anything you want us to know? Because I know you said there are many types of, there's more than one type of lupus, which I didn't know that until you just told me.
Yes.
So what is there anything else you want our audience, my audience, your audience, anybody else to know about
Okay.
lupus, about the struggle, about how they can get help, and maybe even lean on other people?
Yes. So there are four types of lupus. Right. Like I said, mine is called systemic lupus erythematosus, which is short for SLE. You have the cutaneous lupus, which is I don't know if you guys ever knew, but Seal has lupus. That's why he has that thing on his face. He has that one where it affects you, and it's called a form of a rash. Um, you also have the drug-induced lupus, and you have a neonatal lupus where, because I'm a carrier, my child can get it as well. We're still out on the actual time or frame or what have you. And then you also have nephritis lupus, which is what Nick Cannon has, and he has to go get dialysis and all that stuff as well, and he's in the hospital. But the one most important thing I want any and everybody to learn is, please be mindful of any and everybody that has an immune, not just for us, but for MS, for anybody that has rheumatoid, anybody that has sciatica, anything that's an immune system, something that you pretty much can't quote unquote see. Just because you don't see us in pain does not mean that we're not in pain. I go through a whole lot, but I walk in my warriorness and I walk in stride and I don't let it defeat me. This is a condition of my life. It's not a disease. It's a condition that I every day struggle with. I have so much other things to the where I don't even have medication right now, but I don't let that stop me. I do what I have to do. I go get me on a leave or whatever I can afford at that time, and I keep it moving. But any and everybody can ask questions, but ask the right questions. And please be mindful of what you say and how you say them. Be mindful of how you ask the question and be mindful of the knowledge that you want to learn. If you want to know something, ask it, but ask in a way that's like Moondog say, tactful, not in a disrespectful way, because it really mentally messes with people. And like I said earlier, not all of us are as strong as I am. Because Moondog can tell you, I'll tell you how I feel in a minute, but not everybody is me. And a lot of warriors go home at night and you don't know the struggles that they deal with. So that's all I have to say. And as you can see, I have my lupus shirt on, and that's my story, my lupus and my strength.
She will tell you what's on her mind. She's told me what's on her mind quite a few times before. I had to go back. I had to go back and look at the message. Like what? You know what I'm saying? But that's a story for another time. You know what I'm
Yes,
saying?
yes,
But with that being said, hey, Miss Woods, Mo, Lupus
yes,
Butterfly, the warrior herself. Hey, thank you for your support. I hope a lot of people get something out of this, not only about dealing with lupus and people deal with lupus, but as far as how to talk to people
yes,
and be mindful of what they say.
yes, yes. That's the
With
most
that being said,
important.
hey man, it's your boy MoonDog38732 for the MoonDog38732 show on YouTube. Hey man, watch the show, like the show, subscribe, share, and comment. Also, look at the .com, get the merchandise, Tiffany DJ, and get the podcast popping. Man, I'm out.